Hello, everybody, and welcome to this special session of Chip Talks. Today, we're going to talk about plant therapies. So, you've probably heard a lot of people talk about plant therapies. Well, what does that mean exactly? What's a plant therapy versus a pharmaceutical therapy, right? So what's the difference between plants and, let's say, drugs? Well, let's talk that through a little bit. So, what is a drug? Well, a drug is, these terms are specific and mean something, let's just say, professionally. So a drug is something that has been through FDA clinical trials and passed, right? So the FDA is who decides whether something is a drug or not after you have submitted it. Let me walk you through an example of this because I think this is the easiest way to make this clear. But the thing that I want to compare and contrast is natural products, which we'll call plant therapies for the purpose of this video, versus real drugs, okay? So how does that work? Well, let's say you're a researcher and you want to solve pain management, right? So you go down to the jungles in Peru and you start wandering around and you talk to some shamans and they say, hey, this berry works great for pain, and you try it because you've got a bad back and it works good for your pain. And you talk to the locals and they say, yeah, that's what we use all the time. Very safe, very good stuff. So you take it back and you give it to a couple of your friends who have pain issues, and the berry works. Oh my gosh, you can change the world now. You've cured pain. Well, not quite that easy. First of all, you have to this is a new thing, right? Even though they've been taking it down in Peru for a long time, no one's taking it here. Is it safe? Who knows? So you got to prove safety on it. So you've got to go take it to animal testing and things like that to prove that it's going to be safe for human consumption. If you're a smart businessman, you've got to figure out what's the goodie in there. What's the active molecule? What's the thing that's really, helping with pain? And you're going to want to figure that out, and you're going to want to isolate that molecule, and then you're going to want to copy it. You're going to want to synthesize that molecule, and that's what you patent, okay? So after you've patented your molecule, now you take it to file for an IND, for more safety studies, for all the way up the FDA clinical trials path through phase 1, phase 2, and phase 3 clinical trials. After your berry's gone through all that, then now it's a drug, and it can be prescribed by a doctor, and a pharmacist can fill a prescription prescribed by a doctor, and the FDA has approved it as a drug. So that's the way that kind of pharma works and drug development work. Now, the important thing for you to remember, and again, we're trying to give you the ability to control your health. We want you to take back control of your health, and most of us don't realize how to do that or how easy it is, let's say, to do that. Well, nature has always provided us with the cures, and pharma, every single pharma drug is based on some aspect of nature. Again, they might have come up with, created chemistry for some special drug, but that is the way exception to the rule. Most of the time, they're just copying nature and synthesizing nature. Okay, so how does this work? Is every plant in your backyard medicinal? Well, potentially. It's every plant will have some kind of what they call flavonoids that are usually special things that are special to that plant. So sage will have special stuff that only sage has. Turmeric will have special stuff that only turmeric has, and ginger will have special stuff that only ginger has. But then plants also have things called terpenes that are pharmacologically active, meaning they affect you. So if you know about cannabis, you know about terpenes, but terpenes are what give plants their pesticide ability and their kind of smell and taste, if you will. And then, some plants are super sophisticated. So if you take a plant like, let's say, something like black pepper. Black pepper has beta-caryophyllene in it, which is a terpene. And terpenes are, beta-caryophyllene in particular, is pharmacologically active at the CB2 neuroreceptor inside the endocannabinoid system. So that's super important. This is table black pepper, by the way. It also has something in it called pepperine, and pepperine slows your liver down. So it actually can help you absorb things that are hard to absorb, and it can help things stay active, like pharmacologically active, longer. So pepper is a very useful thing, but pepper is kind of a, let's say, a simple, herb. It's got two or three, four interesting things in it. And most herbs are kind of like pepper, so they've got some interesting things that will, like little screwdrivers, let's say, that you can get in and do fine work with. But a lot of plants are more sophisticated and have a lot of flavonoids and a lot of pharmacological power. So something like curcumin, or something like turmeric, has a lot of stuff in it. So curcuminoids that are in turmeric, there's a lot of those, and they have different properties. And they're all pharmacologically active, meaning that they will help you, in certain ways. Curcumin or turmeric on the whole is, it's comparable to metformin, which is the diabetes drug, right? So it's a very powerful plant. But the power of the plant is because of all these little guys that are in there that have pharmacological activity. Cannabis is probably the most active plant that I've ever run across. Cannabis has things in it called cannabinoids. So THC and CBD are cannabinoids, and cannabis can have hundreds of cannabinoids. Cannabis can have hundreds of different terpenes, and cannabis has flavonoids in it that aren't really realized by the industry yet. So a plant like cannabis is very, very pharmacologically active and very sophisticated. And it needs to be because it really impacts our most sophisticated system called the endocannabinoid system. Thank you. We'll leave it there. So that's all on plant therapies. Again, God's always given us the cures. They're in nature. They're in those plants. And we need to take them and build our plant therapies with them. See you guys.